I don't know, I just feel like it's going to be super painful. I'm having twins, so that's going to be two babies coming out of me. I don't know how I'm going to be able to handle that.
Absolutely. Well, Rebecca, everyone experiences pain differently, and we all have a different threshold. So, but what we can do is we can certainly help you manage your pain, and there's lots of options. How do you feel about getting medications, or are you wanting to, what is your plan for your pain control during your birth?
Not anything specific, but I definitely want to try drugs to get rid of my pain, but as long as it doesn't affect my baby.
Okay.
This.
Absolutely, that's a very genuine concern for sure, and a lot of women are afraid of that. And sometimes women will avoid getting pain medication because they're afraid of the effects on the baby. But we do monitor that quite closely, and we have medications that reverses that as well if it becomes a complication or it puts the baby or yourself even at danger. So one of the options you can have is the nitrous oxide, which is known as commonly as laughing gas.
Oh, yeah, I've heard of that.
Yeah, so you could have that. Also, quite commonly we provide with morphine, and that really helps with a lot of the laboring pains during active labor. And sometimes they're actually will do this through an epidural or a spinal, and depending on the anesthesiologist and the doctor, and of course what you're comfortable with in receiving. But also with the epidural and the spinal, this will carry you through in the postpartum period as well. And it really works really well with the recovery period because you're receiving the medication over a continuous period of time and a sort of a slower release. And what we find is a lot of times is after the delivery, we're no longer giving you any more opioids, which is considered like the morphine and such, because you still have that medication that is circulating in your spinal cord from the anesthesiologist. So what we can provide you with is a self-medicating package, and which you can administer yourself, and we'll go through it with you, and it'll consist of some Tylenol and some ibuprofen and some DocuSate, which will help with just the ease of your bowel movement and when that does return, so you're not straining and having to have those discomforts.
Okay. What if I don't take my medication for pain?
Rebecca, the thing is about poor pain control is that it will lead to your discomfort, and you'll feel really probably dissatisfied, which is going to impede in your recovery, being a longer recovery time, and it's going to potentially affect your ambulation. So we really need you to get up and ambulate the sooner the better after postpartum, after you have the babies. And as well, breastfeeding, it can be affected, and bonding with your babies as well. If you're having pain, then it's going to be difficult for you to breastfeed and to feel less anxiety about that. Some other issues that could happen as well is that you'd be at more risk of blood clot formation due to your decreased level of activity. And when you have a baby, you're in that your body goes into a hypercoagulated state. So you're going to be forming blood clots, whereas you've got the vessel damage after you have babies. There's trauma there, inevitably, and pneumonia as well. Hey Rebecca, so how are you doing with your pain? Where are you at with that on the scale of 0 to 10?
Nurse T, my vajayjay is hurting so much.
So for your vaginal discomfort, what we can do is I'm gonna grab you some ice, and we'll wrap that up in a face cloth, or just as long as it's not iced directly onto your skin. And that really helps a lot of women with the swelling and the discomfort down there. It's a short-term relief, but also what is recommended is to, every time you get up to use the washroom, Rebecca, what I want you to do is just use that Perry bottle that's in there. We'll fill it up with just some warm water, and you can just pour that over yourself, and after you use the washroom, because you don't want to, that's a very fragile area, as I'm sure you know. and we don't want to cause any more tissue damage there. So you can just pat it dry, and you should change your pads as well each time that you get up to the bathroom. Ring your bell so that we can monitor your flow and make sure that everything's okay that way as well, just so we know how heavy and or light that you're at. Other things that you can do as well, Rebecca, is Kegel exercises. That will help strengthen your pelvic floor. So every time you go to the bathroom, just stop and start your urine flow again, and that will strengthen your muscles down there. So the self-medication package, how's that working for you?
Working pretty well.
Yeah? You've taken something in the last little while?
Oh, yeah.
Every time you cough or you sneeze or you blow your nose, I want you to splint your incision. So you can do that with your pillow. And if your pillow is not handy, you can just use your hand and splint that. Okay?
Okay.
Great. And also, I would suggest is a pillow when you're sitting down, if you're having some discomfort, which most women do, in your bottom, is you can sit on a pillow as well, and just a nice soft cushion, and that'll help the discomfort you have there.